Misconceptions is Dr. Ankit Bharat, Chief of Thoracic Surgery, who performs COVID lung transplants at Northwestern Medicine. Doctor, thank you for being with us.
Well, thank you for having me.
Well, by the time a COVID patient reaches you, they've got to be in pretty bad shape. Does that mean the regrets have kicked in?
Yes, we see patients from many walks of life, and we see a lot of patients with concerns and myths. Unfortunately, by the time they get us and then they hear the true story behind the vaccines, they are very frequently quite regretful. They feel like they were misinformed about the vaccines, and had they been had they had the right information and taken the vaccine, they would not be in that situation.
Doctor, can you name one of the most bizarre things you've been told as far as myths, and then follow up with one that has valid concerns?
Yeah, so as I said, we see patients from all across, and some of the concerns that we hear about it, they're very shocking. Probably the most bizarre myth that I've heard is that these vaccines have a tracking device inside, and this is all meant to track all our movements and violate personal liberties and so forth. Anyway, we can talk about it for a long time, but the two things I want to specifically try to address are concerns related to safety. So patients have expressed concerns that sometimes when they get the vaccine and develop symptoms, they may actually become infected by the COVID virus, and they can transmit that virus to their family members. So I want to just be very clear, there's no possible way that after getting the vaccine, and I'm talking about the mRNA vaccine, you can transmit the virus to other members. These vaccines do not contain the virus. It's just meant to train your body to respond to the virus if the body is exposed. The second thing is about the efficacy of the virus, and every day we hear about vaccinated patients getting COVID. So certainly that's raised a concern in a number of people, and I want to again make it very clear that the main purpose of these vaccines is to prevent death, is to prevent the severe form of the effects of COVID. Most, if not all, the patients right now in the hospital who are in critical state, requiring ventilator, requiring ECMO machine, they've been unvaccinated. It's highly, highly unlikely that after getting the complete vaccine dose, you'll be in that state. So it's possible to get the infection, but you're not going to die if you're fully vaccinated. So it's very important to remember that point.
It is a good point, because we hear it all the time from people who say, oh, look, cases are going through the roof. See, the vaccine is not effective. But the vaccine, to your point, is meant to keep you out of the hospital, keep you from meeting you. Where are people who have had these myths, this misinformation, influencing them not to get the vaccine? Do they say where they're getting that information from?
Yes, mostly it's social media, mostly through people who or their friends, colleagues. These are not scientists or physicians, but I would say majority of what I've experienced in my clinics is through social media.
I do have a question about the Omicron variant. I mean, there has been reports that certain vaccines are not working as well with Omicron. What do you say to people who ask about, in particular, the Omicron variant?
Yeah, so first of all, we are, the medical community is working very hard to look into the effects of Omicron and the vaccines and the protection. The first thing I want to say is that Delta is still there. Lots of the prior variants, which are still creating havoc, they're still prevalent in the community, and these vaccines work against them. The second point I want to make is these vaccines, again, I don't want to speculate because we'll have this data, but if you get the full vaccine dosing and the booster, there is a very, very high probability that they will be protective against Omicron as well, because these vaccines train the body to recognize the virus at many different points. So while you can have some mutations in the Omicron, it will absolutely allow the body to attack the other parts of the Omicron virus as well.
Dr. Ankit Bharat, bottom line, you get boosted, you're not going to meet you. hopefully. Thank
Yes,
you so
either
much.
get the vaccine or you might need a lung transplant.
Yeah.
know,
Thank you
make
so
a
much
choice.
for joining us and helping us understand what those folks, what those seriously ill patients are saying to you. Thank you.
Thank you.
Okay, let's check in with Tom Skilling for an update on the